Everyone, you can see my slide? Okay.
Yes, we
Good.
can.
Okay, very good. So, uh, what I want to do today is to share briefly the history of this organization, Unite for Her, and our experience with integrating acupuncture into modern oncology care for women undergoing conventional care for breast and ovarian cancer. I think the experience that we have had so far has some helpful lessons for us about communicating with the public and our colleagues in the medical community about acupuncture. Unite for Her is a nonprofit national organization with a mission to provide. I'm going to just, I've got a lot of things open here on. We do just do like that. Okay. With a mission to provide cancer patients with a whole patient care experience. Unite for Her uh, sponsors, promotes, funds a comprehensive integrative care wellness program that offers a variety of complementary therapies, medical acupuncture, oncology massage, yoga, whole foods nutrition counseling, and mental health support. Unite for Her partners with cancer centers in our area to provide this care to women undergoing conventional care for breast and ovarian cancer. Its mission is to provide essential care that modern oncology is not able to give and to work in partnership with modern oncology care for these patients. Oh, here we go. So this Unite for Her started with the experience of one person, a patient of mine, who found acupuncture profoundly helpful in her experience of cancer care. When I met her about 18 years ago, she was a 39-year-old mother of three children. She was a national level gymnastics coach. She had undergone bilateral mastectomy and was just finishing 12 rounds of chemotherapy for an estrogen positive breast carcinoma. She was technically cured, according to the modern oncologists. Um, Her conventional therapy was concluding in a successful way, but her health, her sense of self, her life, as she would say, seemed to have been completely lost at the end of her successful modern cancer care. She had hot flashes, night sweats, chronic insomnia, chronic anxiety, headaches, nausea, and depression. Her experience working with me with acupuncture, she had the profound and wonderful experience of having these problems resolved and finding her feeling of health really, really restored. So she recognized as she was talking with other cancer patients that this care is not routinely provided in oncology care or paid for by insurances. And she determined that she wanted to find a way to educate women and provide funding for women with breast cancer care to have true access for this type of care that she had found so beneficial. These are the core therapies that Sue and Unite for Her have worked to educate women about and to provide access to and funding to support. Unite for Her raises the funds, educates women and their caregivers, the entire medical spectrum of medical teams involved with this kind of care, and has created a group of vetted, experienced providers in all of these areas near all of the hospitals that we have partnered with. Um, so, this effort to educate women undergoing breast cancer care and their physicians about these therapies began with one patient, I'm sorry, began with one hospital, 23 patients in 2009. This was Sue Weldon's hospital. The We started with an educational 5 hour, what we called a wellness day, where we met with these women and educated them about each of the therapies that were being offered by Unite for Her. After this initial partnership with this one hospital, it was so well received by the women and by the hospital, uh, uh, some important people in the hospital staff, that the chief of surgery and the president of the hospital joined the board of directors of this fledgling young organization, Unite for Her. So the partnership with this first hospital was a big success, and we then saw the network grow as each hospital in the area that we partnered with wanted found it also very, very helpful, and wanted not only to have this event happen, but wanted the events to continue to happen. So each hospital we partnered with um, decided they wanted this to be an ongoing partnership. And so by 2018, we were up to 20 cancer centers in our area, including the big university cancer centers. This is in our region of southeastern Pennsylvania. And by 2018, we had gone from 23 women being referred into the program to over 1,000 women being referred into the program by their physicians and cancer care team. And in this last fiscal year, we served over 10,000 women were referred into this program. So now Unite for Her has a national presence. Actually, we've grown from just our region. Our Unite for Her team, the staff, the board of directors, and the advisors, these are three separate groups, now include 50 people, 5 oncologists, 2 breast surgeons, and 1 internal medicine medical acupuncturist. That is me. I've been the advisor on acupuncture for the organization since its beginning. Our providers include 38 acupuncturists. Our goal is to have uh, a team of physician acupuncturists that are near to each of the hospitals that we have, hospital cancer centers that we have partnered with. So, Unite for Her, the uh, acceptance and appreciation of this program by both the patients and the professional oncology community has really grown. As I said, all the hospitals we have partnered with have wanted to continue this partnership. And so the number of cancer centers that we work with have grown to include all the major cancer centers in our region. We have Unite for Her, as I said, is a nonprofit organization that raises funds to support the care of these women to have these therapies. Um, we have many sponsors now, 15 years into the program. We have many sponsors from industry as well as the community. This picture is Sue Weldon in the middle and 2 of her staff at the national meeting of the Society for Clinical Oncology, where they were presenting Unite for Her's work and gaining sponsors and grants. Now, um, medical acupuncture uh, is considered by the CEO and founder of Unite for Her, Sue Weldon. She considered medical acupuncture to be the central therapy that she wants every woman with breast or ovarian cancer to be educated about and to have access to. And as I said, I've been the advisor on acupuncture from the inception of Unite for Her. And this is what I want to share specifically with you today. One of my roles um, has been to interview and approve all the medical acupuncturists who are enrolled as providers around the different cancer centers that we partner with. We want our medical acupuncturists to not only be physicians, but also to be experienced, of course, with this type of patient and to be conveniently located near the cancer centers that we have partnered with. My other primary responsibility has been the educational effort towards the public and the healthcare community about acupuncture. And that's what I want to talk about specifically today. So this this topic of introducing medical acupuncture to patients and medical care community, I realized that this was a fantastic opportunity, not only to help an important group of patients to understand the value of acupuncture for their what they were experiencing, but also I knew that we would be educating their physicians and the other healthcare providers on their team. And so we wanted, I specifically wanted to make the message to be inclusive and important for all of these uh, important listeners. The goal, the goal of the educational message is to provide a consistent message that communicates the value of acupuncture to the listeners. This is the goal, to communicate the value of acupuncture to the listeners. The discussion needed to be meaningful to patients, physicians, healthcare providers, hospital administrators, public health, and relevant government agency representatives, all of which would be in the audience to different degrees. So when I say meaningful for the listeners, I mean meaningful for their problems. That means any kind of discussion that isn't directly geared towards helping them understand the value for what they're actually facing and experience, the types of problems, the situations, the side effects of modern therapy, etc., were considered not relevant to the discussion. I wanted us to use our time there with them to the highest value towards this goal. Also, it was decided that the language must be the language of modern science, that the discussions must answer their relevant questions, as I mentioned. Can it be shown to be beneficial? What kind of problems? What do we know about what the modern science shows about it? How does it work that we know from the standpoint of modern science? All of this must be in a language that makes sense to them, that is familiar to them. And that, of course, is scientific language. The scientific language is the lingua franca of the modern society when we talk about health. All of our acupuncturists, the goal was to have all of them be physicians. Patients and other healthcare providers want this. They want their providers to be physicians who are dual trained in modern medicine and acupuncture. We, in the educational talks, uh, I use real case examples of the different types of clinical problems relevant to this group, and uh, and I connect with that a relevant basic science study showing, um, that this case illustrates something that modern science has now demonstrated about acupuncture, and I connect the case with modern clinical study from a peer-reviewed journal on acupuncture for this clinical syndrome. This is a format that doctors and patients very much appreciate. These linking of real case examples with some discussion the patients can relate to because that's they're looking at themselves, and these cases really speak to the experience of real people, and then to connect basic science studies and clinical studies with a trio of these three together really is something that the patients and their healthcare providers grasp, is a format that doctors very much appreciate also, as well as the patients. All the question and answer and discussions are aimed at relevancy to the patients and their physicians. The discussion of acupuncture It is presented as a sophisticated physiologic stimulus for repair and regulation in the body. There's some touching upon the theory of holism and the largely self-regulating nature of the body that is recognized both in modern medicine and traditional Chinese medicine. And also, when we talk about the largely self-regulating nature of the body, either in modern medicine or in traditional Chinese medicine, the corollary to that recognition is that there are times when the body clearly can't regulate itself by its on its own, and we need to, whether we are practicing Western medicine or traditional Chinese medicine, we need to know how to help the system, how to help the body when it can't get back into a normal state of regulation by itself. And of course, the value of these two experiences of medicine, modern medicine, and the experience that comes out of the world of acupuncture and traditional Chinese medicine, when they work together, they give the perspective and the experience of two um, sets of experience in addressing health and disease. And of course, very, very valuable for us both as doctors and for patients. The patients understand the value of this combination of perspectives and experience. There is in these discussions no discussion of channels, meridians, chi, five elements, energy, etc. Um, the patients don't ask about these things, nor do their doctors. And when they're, if you watch talks when they're given to the general public and to doctors, these topics are often considered strange, off-putting, and irrelevant, actually, to the important effort of helping them to understand the value of acupuncture for the problems they are encountering, and in the case of the doctors, which their patients are encountering. So the language of science and the scientific explorations of acupuncture are really at the heart of this discussion because this is a discussion that can communicate the value of acupuncture. Ours is a message of working together with modern medical care to give a high quality and better health. Our program experience over the last 15 years is that this process that I'm describing functions as an education about acupuncture for all of these women and their physicians. The women go in and the doctors go into these talks, these educational sessions, oftentimes having no experience or knowledge about acupuncture at all. And they come out from the educational introduction and they all feel that they have learned something very important about acupuncture. The response is uniformly positive, and this process turns out to be educational for the public, their doctors, and the hospital administrators. So, this approach of a consistency in message, a science-based education on acupuncture, answering the issues relevant to the listener in a language they understand, which is the language of modern science, I believe really that this is a model for outreach to the public and to the medical community. And I think there are some lessons here. I think this approach is an important reason why we've been so successful at introducing medical acupuncture in this program. And I believe there are some lessons that we've applied here that I think are highly applicable in general for us. So this is what I wanted to share today. If you have any questions or um, comments, or you want to know more about our program, please, you're welcome to email me at my email there. Thank you so much for your attention today.